All right, so I wonder if you could tell us first about why you decided to enter into the field of medicine.
Well, I entered medical school actually unplanned. I was in college and I was a biology major, and I was interested in dental school because I had an uncle who was a dentist, and I thought maybe that would be something I'd be interested in. I enjoyed working with my hands, and sort of thought about going to dental school. And then in my second year of college, my professors suggested that I think about going to medical school, and with that suggestion I pursued a medical education. It was sort of a passive happening, but
do you really respect that individual? Is that why you decided?
I did. I certainly did. I had great respect for my three biology teachers. They influenced me in a great way, and I thought that I would pursue science in medicine. I enjoyed biology and science in high school, but I never really thought about it as medicine as a possible career. My parents did not have a college education, and so or that generation of my family did not have a college education. So I was sort of creating my own path without very much parental guidance, a lot of love and support, but perhaps little direction. And so the people that directed me were the people in college that I met that were very excellent teachers and wonderful people, and they had a meaningful impression upon me. So I followed that course and went to medical school.
You haven't regretted it since?
I have not regretted it. I'm so happy that I went to medical school, and I'm happy to really credit my teachers for directing me. And that's what teachers are supposed to do. They're supposed to teach you, but I do think they should help get to know their students and help you with career planning. Now, not in large universities, that's perhaps not possible, but it's an advantage of a smaller college where the student and the professors get to know one another, and it's beyond your grades. It's get to know you as an individual and offer you direction. Now that we have career planners, and we've created departments for that type of direction, but the individual teacher is the one that relates with the professor, and I mean the individual professor relates with the student, and the student admires the teacher and professor and follows that direction. So that's how I ended up in medical school, and it was the best thing that could have happened to me. So I'm very grateful to them. I want to acknowledge them.
So where did you attend medical school?
I went to the University of Maryland School of Medicine. In Baltimore. I was born in Worcester and raised for the most part in Worcester, except for about 10 years during the Depression. My family, my mother and father and brother and we moved to Athol. And I lived in Athol for 10 years. Between ages 10 and 18, I graduated from Athol High School, and then I went off to college. And at that time, my parents moved back to Worcester, so I've had a Worcester connection since then. And I went to the University of Maryland. I applied to 8 medical schools in the Northeast. I wanted to be in the Northeastern United States, and the University of Maryland School of Medicine was the first school I heard from and I had an acceptance. And at that time I had a cousin who was at Johns Hopkins Medical School. He was in his 3rd year there. And he told me not to look any further, to go to Maryland and enjoy my senior year of college. So I did go to the University of Maryland, and that was a wonderful selection. I'm very happy that I went there, and I'm very grateful to my education at the University of Maryland and the teachers that I met there that were so meaningful to me, and again creating a direction for me by their actions and influence. Directed me into the specialty of internal medicine and infectious diseases. I'm particularly grateful to Dr. Theodore Woodward, who is still alive, and we're very good friends, and he's in his mid-80s, and we communicate, and I have respectful admiration and love for the relationship that we've developed, and he's made a very positive influence in my career.
He was one of your classmates, or one of
He was my teachers. He was my teacher. Yeah, he was my teachers and became the head of the Department of Medicine at the University of Maryland. I was in medical school, and then I did postgraduate training there with him as well. So it was a great experience. I remember it fondly.
What year did you graduate medical school?
I graduated medical school in 1955.
Do you remember how much it cost approximately to attend?
No, it was, I was at the University of Maryland. Maryland is now a state university. It was a state university, like the University of Massachusetts Medical School. It now selects its student body primarily from residents of the state of Maryland. But when I applied, it accepted students from all over the United States, and 40% of the class, my class, were students from outside of the state of Maryland. And I don't remember whether we may have paid a little bit more, but and I don't remember exactly the cost of the tuition in medical school, but it was it certainly was not to the degree it is today, but neither were the earnings in those days, so everything is sort of proportionate. So, but inflation has influenced medical education enormously. The best indicator is that I did not graduate medical school owing money, and the average medical school graduate today has an indebtedness of about $100,000. So I mean that says a lot. That says a lot, and it's very difficult for the students today. Much more difficult today than it was when I went to medical school. I had assistance from my parents, and was largely educated through that source. And my parents were not wealthy people, financially wealthy people. They were. I'm of course indebted to my parents for all their support, including their financial support. So, but I'm sure you heard this from others, that coming out of medical school today with an indebtedness of $100,000 or more is a very enormous burden for young people. But it should not be a reason not to go to medical school, because the opportunities and the education and the fulfillment is so wonderful. It outweighs that negative financial circumstance.
Do you think being in debt that much money influences young graduates as to what specialties they're going to pursue?
It might, but it should not. It might, but it should not. And the economics of healthcare have really they're on the radar, on everybody's radar screen. So I I predict that by the time you complete your medical education in 3 more years, there'll be some significant changes in how medicine is financed. So things have to change. They can't continue to accelerate the way they are now. Today, the cost of healthcare in the United States is $1.4 trillion. And and it's going up. A few years ago, it was $1 trillion. Now it's $1.4 trillion. It's just, and there's so much, still so much inequity in the system. So it has to be corrected, because everybody needs to have access to health care, regardless of whether you can pay for it or you can't pay for it. If you have the need comes first. And we need to develop a system that provides for the reimbursement for those services, and the cost for those services have to be adjusted so that everyone's accountable, and indeed it's affordable to whoever pays the bills. It has to be affordable. We can't have exorbitant, outrageous costs. We have to have balanced costs, and everybody has to be served. So I think there's going to be a change. It's changing all the time. And today, in government in Washington, they're deliberating it all the time.
Yeah.
Today's the patient rights, the Bill of the Patient's Rights, and that's currently being addressed by the Congress.
So just to take a step back, after you finished medical school, you decided to go into your residency. Did you stay in Maryland for that as well, or did you go somewhere else?
I did what they called then a straight medical internship. I did internal medicine for 1 year at the University of Maryland Hospital in Baltimore. And then I was anxious to return home. My parents lived in Worcester, and I returned home, and I went to the New England Medical Center, the Tufts University School of Medicine hospital, and I did my second year of residency there. It was called, again, a internal medicine residency, and that was a great experience both at Maryland and at Tufts. It also, by social experiences, I met my wife during that year. She was a student at Simmons College, my wife Maxine, and that I completed that year, and I was drafted in the Army. I had a military service obligation, and I was drafted in the Army, and Maxine and I were married. That was in 1957. I graduated in 55, and this was in 1957. And then my wife and I went in the Army, and I was stationed in the Army Research and Development Department at the Walter Reed Army Institute of Research, at Walter Reed Army Medical Center. It's in Washington, D.C., and I was assigned to the Communicable Disease Division. I was interested in infectious diseases, and I spent 2 years working there as a captain in the United States Army in this infectious disease division under the direction of the late Dr. Jeffrey Edsel, who was the head of that department, and my immediate supervisor was the late Major Edward Busher. I think he was then a major. He may have his rank, I'm sure, increased to perhaps colonel, but Ed Bush had died prematurely, so, but I had a great experience working with Dr. Busher. Dr. Busher was a very brilliant infectious disease researcher. He was interested in arthropod-borne infections. That particular laboratory that I worked in was concerned with those viral infections that are transmitted by arthropods, mosquitoes particularly. And I worked in that, and viruses that particularly caused infection of the central nervous system. So it was a very interesting experience working there. I enjoyed that very much, and it brought me to Thailand for an experience studying hemorrhagic fever in 1958. And then I returned to Washington and continued working there in this arthropod-borne virus disease laboratory.
How was it like studying hemorrhagic fever? You also saw quite a few difficult cases.
It was a very interesting experience. I went to, I represented this laboratory in the United States Army in with a team headed by the late Dr. William McD. Hammond from the University of Pittsburgh, who was the University of Pittsburgh School of Public Health, who was a specialist in mosquito-borne diseases. And I went over there to work with that team, and that particular outbreak was in Bangkok, Thailand, and it was the first study of hemorrhagic fever in which a virus was isolated. There had been previous occurrences of hemorrhagic fever, but the viral etiology had not been established until this outbreak in 1958 in Bangkok, and we isolated dengue virus 3 and 4, and that was a very important discovery, and I'm very proud to have played a part in it. I followed all the directions that my research experts had planned, and it was really very interesting. So it was the dengue virus. It was mosquito-borne.
I thought that was a mouse, a rodent-borne virus.
No, this was mosquito-borne, and it happened. In Thailand, the disease outbreak occurred during the rainy season when there was a lot of stagnant water, and the mosquito population increased. It's interesting, and it followed the dry season when it was less water and people were driven to polluted water supplies, and they had cholera. So the cholera happened in the dry season, and then in the rainy season they had diseases associated with the increase in mosquito population. So it was a very great experience, and I then left the military in 1959, and I returned to the University of Maryland, and I did a fellowship in infectious diseases under the direction of the late Dr. Fred McCrum, who was it was a very interesting experience, and Dr. McCrum's interest was in measles vaccine, and I worked with him on measles vaccine, and did some of the first trials with measles vaccine in Missouri. And that was a year, and then Dr. Woodward, my teacher and professor, asked me to serve the following year as the chief medical resident at the University of Maryland Hospital, where I had done my internship. And I was very honored to do that. And then he wanted me to stay at the University of Maryland, and my parents, as I told you earlier, were in Worcester, and my wife was from Springfield, and her parents were in Springfield, and we just felt that we wanted to come closer to home. So we returned to Worcester in 1961, and I've been here ever since.
So
1960, that's 40 years. This is the 40th year.
So you spent your entire career after your residency practicing in Worcester?
In Worcester. Since 1961 forward to now, 40 years I've been in Worcester.
What did you enjoy most about being in Worcester? Anything in particular?
Oh, wow, I love Worcester. You know, I'm a native. I was born here. It's home, and I had a wonderful experience practicing medicine. I practiced medicine initially for 5 years with an office on Lincoln Street. And then I moved my office to St. Vincent Hospital to head up an infectious disease laboratory and department. And I did that that was 61, 66 to 71. So I did that for about 5 years. I was 5 years in practice, 5 years there, and then there was transition. That was when the University of Massachusetts Medical School was being established and opening, and there was a transition of people, and there were changes, and with the change, I decided that I'd return to the community and practice. So I practiced in Worcester, and I became involved with the Worcester Department of Public Health, and I practiced internal medicine, infectious diseases, and then I worked for the Worcester Department of Public Health as an epidemiologist, and oversaw their laboratory, the public health laboratory. And I'm very grateful to the Department of Public Health. I had a wonderful experience working with them, and my work with it, I learned so much working with the Department of Public Health, because I met a lot of people with different disciplines, public health workers, and I learned an awful lot from them, and I just became part of their team, and we did an awful lot of important work in the past actually 40 years working with the Department of Public Health and St. Vincent Hospital. I'm grateful for the opportunity to have been able to come back to St. Vincent Hospital to serve in the community, and I'm grateful to the Worcester Department of Public Health for allowing me the opportunity to work part-time with them and always be available. The Worcester Health Department presently has a part-time commissioner who's a physician, Dr. Arnold Gurwitz. He's a pediatrician. And I served as a part-time epidemiologist and head of their laboratory. So the two physicians work for the city's health department as part-time jobs, and it was great for us, and I think it was great for the city, because we were, based on our practices, were very close to what was happening in the community health-wise. I in internal medicine, Dr. Gurwitz in pediatrics. And then when he was away, I was here, and vice versa, so that provided good coverage, and the city had a good value in having two doctors rather than perhaps one full-time public health commissioner. It worked out very well. We had a lot of experiences that we've published that were very meaningful. And now I'm semi-retired, and I've been appointed to the Worcester Department of Public Health Board of Health. So I now serve on the Board of Health. So I've really been very involved in public health in the city for all these years.
And I hear you solved some interesting puzzles as well throughout your career, such as one at Holy Cross.
Yeah, we did. We had some great experiences. You've done some of your homework. They must have given you some reading material to ask some pointed questions. Yeah, we did. We as I said, I was by title the epidemiologist, and I was actually, it was in 1969. So I had returned to Worcester in '61. In '69. In October, September and October, there was an outbreak of hepatitis A infection that involved the varsity football team at Holy Cross College. And it involved, of that whole group of people, there were 90 players out of 97 players and coaches and staff. About 90 players came down with hepatitis A. And it happened just at the beginning of the football season. The team played Harvard on I think the last week of September, and then they played Dartmouth the first week in October. And that Dartmouth game, it was very apparent that the players were getting sick driving up from Worcester to Hanover, New Hampshire, and had to come back. And then looking at the films of the football players during the game, it was very apparent that the players were ill. So they were just not feeling well. They called them rubber legs, and Dartmouth won the game. I think it was 52-0 or something like that. And the team came back to Worcester that Saturday night, and Sunday morning the blood samples were taken, and it was apparent that they had hepatitis A. And then I was called as an epidemiologist. I was at St. Vincent Hospital, and the hospital permitted me the time to lead the epidemiologic investigation with the health department. And that was an enormous happening. You have 90 people ill. The football season was then ended with that Dartmouth game. They couldn't field the team, and it had a lot of impact in the community, in the region, the nation, and the world. So we organized. It was organized very effectively. I was responsible for the epidemiologic investigation. There were two wonderful colleagues that have since passed. Dr. Joseph Hurley and Dr. Joseph Murphy were the school physicians, and they took care of the players. They used one dormitory at Holy Cross College and made it an infirmary, and all the players were housed there. And then we did the laboratory work at St. Vincent. And then another doctor, Dr. Thomas O'Brien, who's an infectious disease doctor at the Brigham and Women's Hospital, and a graduate of Holy Cross College, and an infectious disease researcher. He stored up all of our specimens. We collected specimens, and he sort of carried on the research endeavors. And then a representative from the college was responsible for all the media inquiry, and so that's how it was divided. And all to make a long story, not too much longer, we saved specimens from the players serially, and then when because the virus laboratory techniques of virology with the hepatitis virus really had not been discovered then. We saved the specimens, stored them at -60 degrees centigrade until the methodology in virus research caught up. And then when it had, we thawed those specimens and determined that our clinical presumption that this was hepatitis A virus was borne out by the serology, the testing, which was really good because, I mean, we had all these players that were ill, and we had to establish the diagnosis based on clinical experience and observation. We didn't have a laboratory test then that would specifically identify hepatitis A virus, but eventually, I think it was maybe 5 or 6 or 7 years later, and then the whole virus methodology outlined that what was called hepatitis A, infectious hepatitis was hepatitis A, serum hepatitis was hepatitis B, non-A, non-B hepatitis was C, hepatitis C, and the puzzle unfolded sometime after this outbreak.
How long did it take you to find the source of the outbreak?
We studied that outbreak 2 weeks. We had it pretty well analyzed in 2 weeks. But I mean, I owe an awful lot of credit to hydraulic engineers and people who know a lot about water supply. The late John Riley, who was a director of the Worcester Health Department, was very instrumental. And many of the people that still work in the Worcester Health Department were involved, and I learned an awful lot from them.
Could you tell us what the source was, real quick?
The source of that outbreak. Well, it was interesting that only the varsity football team players were ill. The freshman football team, which was not ill, dormitory proctors were not ill, and the college staff that were there during the summer were not ill. It was only the varsity football team, and there was a high incidence of hepatitis A. We called it then infectious hepatitis because we didn't know it was A, B, or C, or now D. We called it infectious hepatitis. There was a high incidence of infectious hepatitis in Worcester at that time, during that summer, and it was the team practiced at a football field high on top of College Hill, and the water supply to that field also ran underground with interruptions along the way for faucets to irrigate the field so the grass would be kept green. At the end of the line was the faucet for the drinking water. And these, with the interruption in the line, there was contamination of surface water into the system due to a negative pressure in the system that occurred coincident with a fire. At the time, we postulated they became ill because the incubation period is 4 weeks. So we went back and checked the fire department records, and indeed there was a 2-alarm fire, and then we recreated the hydraulics at that field by opening hydrants proximal to the field and could create a negative pressure in the system. And so surface water was siphoned back into the system due to negative pressure, and then when the pressure was restored, when they drew water from the system, it carried with it water that was infected with the hepatitis A virus. And there were 4 or 5 children that lived in a house right next to the field. It was very hot, and they would come to the field at night and put on these faucets, and so the water pooled and puddled, and they would play in the water. and they didn't have the ability to tighten them up and close them or whatever. And these children were ill with infectious hepatitis. So we presumed that they contaminated the water, and then with a change in pressure, the next morning when the football players came and drew their water supply, they drank contaminated water. The other thing that made us directed our attention to the water was that so many of the players were involved. That up to that time, you think of people eating raw clams or some other source for hepatitis A virus, but water was the source. When you had so many people infected, it had to be something that they commonly consumed. So it's an interesting story. I'll send you a reprint.
It's pretty good detective work.
It was interesting, but that was my work with the health department.
Yeah. Okay, I want to change gears a little bit. Ask you about some of the changes that you've seen in Worcester, maybe in the populations that you've treated over your years of practicing. You said you practiced here for quite a number of years. I'm sure you saw many changes in the patient populations that you were treating.
I had a wonderful practice. I practiced in Worcester for 35 years, and then I retired from active practice in 1996. I was there 1961 to 96. 96, I took a job, just to fill out the time, I took a job as a medical director at an inner city community health center in New Bedford. And it's called the Greater New Bedford Community Health Center. And I was their medical director there for 4 years. And that was a really great experience. I really enjoyed being there, and I can tell you more about that, but let me focus in Worcester. I had a wonderful practice. It was nice to be in the community that you were born and raised in, because some of my patients, knew me when I was a child. In fact, some of my patients knew me before I was born. They were friends of my parents, and then to grow up and become a doctor and then have the responsibility of the care is a great privilege, and it was very, very meaningful. And you're able to really identify with these people because you remember your upbringing and their families and the events that they and you had experienced together. So it was really that's a very positive thing about practicing in the community you were born and raised in. And I don't think a lot of people have that opportunity, but should you have that opportunity, it was very, very positive. The other positive aspect of it is, of course, knowing the community, you have, in your daily work, you have deja vu happenings, and you remember your parents and your siblings and your friends and in and around Worcester. So I didn't experience a change in my practice. I had a very established practice. If you practice for 35 years, that's 2 generations. And when I left my practice, I had 1,000 active medical records. So my practice was very active, but it was good. I had an office on Lincoln Street, I think I mentioned earlier, and then when I went to St. Vincent Hospital, and then when I returned from St. Vincent Hospital, a group of us built a building on Lincoln Street at 200 Lincoln Street, and that office building is a professional office building, and my colleagues still are there in that office. There's 6 or 7 doctors there now in the offices that we established. And they're carrying on doing the same thing. It was under the banner of self-employment, private practice, and how important that was. So the biggest change that occurred, it was coincident with the establishment of the University of Massachusetts Medical School and the closing of hospitals. In 1961, there were 7 hospitals in Worcester, including the Holden District Hospital. Now there are there are three, but two systems. The University of Massachusetts and Memorial as two hospitals, but one system, and the St. Vincent Hospital.
So you think a lot of hospitals closed because of medical school coming into the area, or?
Well, the medical school, the hospital it's a huge hospital, and there were abundant hospital beds, or excess beds, so they began to reduce the number of beds, and then if you have below a certain amount, the revenue doesn't support the institution, so the hospitals had to close, and just on that basis alone, the University Hospital here and the University of Massachusetts Medical School was a terrific resource to the community. So there was an adjustment that happened, but I mean, the end result, having this huge institution here, is really terrific for the region, for the state, for the nation, and the world, because of how much the university contributes to healthcare. We're very proud of the University of Massachusetts Medical School. I'm on the clinical faculty, and I've been very active in teaching and in trying to preserve the historical collection and working in the library at the medical school. Yeah. So, but I came here I returned here in open practice in 1961. I think the medical school was established in 71, so it was 10 years earlier. There were a lot of changes that have occurred and are still occurring.
Were you involved at all with initiating getting the medical school set up at the beginning? Or?
Well, we were all supportive of it. I was a little junior at that time in my age to be involved, but I do remember the late Dr. Hyman Heller, who was a general practitioner from Webster, who was president of the Worcester District Medical Society, and the late Dr. Joseph Lundy. Dr. Heller was president when the medical school was established, so he was instrumental speaking on behalf of the medical society. The late Dr. Joseph Lundy, who was an internist here in Worcester, was active, and those physicians were senior to me, and they were, those two in particular come to mind. Dr. Chandler, you met, no, not Dr. Chandler, Dr. Height. You met Dr. Height. They were senior people, and they were involved in supporting the medical school. The late Dr. Sanfrey Lillystrom was very, very supportive, and he was director of the president of the Worcester Medical Library and the Worcester District Medical Society and its library, the Worcester Medical Library, made available the library to the medical school. So when the medical school came to Worcester, one of the greatest gifts it received was the library from the Worcester Medical Library to the medical school. The medical school also purchased the library from the Pittsburgh, from Pittsburgh, and they brought these two libraries together in an amalgamated library, and then built upon it this magnificent library here. But one of the great gifts, in addition to the support, emotional support for the medical school to come here, I think a very concrete gift was the gift of the library. And that's a wonderful thing.
I want to switch gears again, because you only have about 15 minutes. And there's one question I want to make sure I ask everyone, since it's kind of dear to me a little bit. And I was wondering if you have any type of advice you would give to a medical student or a young physician just entering out into practice.
Well, I would encourage anybody who is interested to pursue an education in medicine. I think I have no regrets having studied medicine, and I'm extremely enthusiastic and as idealistic about it now as I was when I entered medical school. And no matter what outside forces are trying to influence medicine, the patient and the doctor are the driving interactions in healthcare delivery. The patient's needs today are the same as they were when I went into practice in 1961, and will be the same in the future. The availability of the doctor to help the patient with those needs will be the same, are the same today as they were in the past, and they will be in the future. So the doctor-patient relationship is really the nidus of good healthcare delivery. Now, I don't use the word doctor to the exclusion of other people that provide healthcare, nurse practitioners and physician's assistants, but we're talking about physicians, and I think that doctor-patient relationship is really the fulcrum, and it is the most rewarding experience to practice medicine, to try to unravel people's infirmities and help them to a path of comfort or improved health or restored health is really, I mean, what's more important in life? It's terrific. And that will continue to be I think, the substance upon which any changes will occur. We cannot change that nidus of the doctor-patient relationship. Patients need access, patients need availability, patients need affordability, and they need good science-based health care. And if you're motivated to do that, I think it's a wonderful experience. You know, that being a doctor, and I can tell you from the perch of a 72-year-old doctor, that you look down on all the happenings in a changing social environment, and you say, wow, what really is important? And you, as a doctor, you have a perspective that nobody else has. You can really evaluate what's important, what's unimportant, and all that's in the gradations in between. And I think that's what you learn from being a physician. That's really an enormous reward. It's a really enormous reward. It doesn't come in legal tender. It comes in experience. And that's worth so much. There's no other profession that has that opportunity to evaluate the importance of what's happening than physicians. And so I compliment you in seeking a career in medicine, and you're on the right course, and all you have to do is the right thing, and you know, you'll be rewarded. I've directed people into medicine that have had minimal resources, financial resources, but enormous intellectual and ethical and moral resources to motivate them to study medicine, and the finances will all be taken care of eventually, and the rewards are not, the financial return is not the important thing. It's the fulfillment from the job. Knowing that you're really out there helping somebody every day, and some days many people in a day. So it's a great experience, and it's going to medical school today is harder than when I went to medical school, I believe, because I think you need to be a little more brilliant, intellectually brilliant now than when I went to medical school, because how do you handle so much information? I mean, genetics and intracellular chemistry and the pharmacology and all I mean, it's really the electronics. I mean, the things that are happening in medicine today are so exciting and require a very, very brilliant mind. But I've always said that the two most important ingredients in being a good doctor is, one, you've got to be kind. You really got to be kind. And the second thing, I think, is you've got to be compulsive. You've got to, if you're kind and compulsive, and then you have to have a certain level of intelligence, of course. I say the level of intelligence is higher today for you people than it was for when I went to medical school, because of the information overload, really. It's really information overload. I mean, how do you keep up with all of the things you have to keep up with? And but you need to have a level of intelligence, and then you select your specialty. But once a physician, you can actually go into any of many choices.
Do you have any favorite memories that you look back on throughout the years of practicing? Maybe interactions with patients or anything that comes to mind, kind of puts a smirk on your face?
No, I think that, I came back to Worcester with interest in infectious diseases and communicable diseases, and that interest was because of the role model of my professor at the University of Maryland Medical School. I came back to Worcester, and I was the only person practicing infectious diseases from Boston to New Haven, Connecticut. I mean, it was, and the needs were working with the health department, and I got involved with the health department, and I had very little training, formal training in public health. And doing that work with the health department was most rewarding, and the hepatitis outbreak was one, but there were a series of 8 or 9 outbreaks that we studied here in Worcester that were really very, very interesting, and I'm extremely proud of that work. That's beyond the practice of medicine. So I would say, bringing that all together, those achievements were perhaps most outstanding. I mean, the community was my laboratory doing public health, so that was really exciting. I'm very proud that in Worcester, since I've been in Worcester, I've always had an academic appointment. Years ago, St. Vincent Hospital was affiliated with Georgetown University, and then the University of Massachusetts was created, and I have a faculty appointment here, and I'm very proud of that. I'm very proud of the University of Massachusetts Medical School and its growth and development. My patient experiences were totally good. I mean, my telephone number appears in the white pages and the yellow pages in the book. I was always available. Nobody ever abused my telephone number being available in the book. Everyone was respectful. I've had a totally good experience practicing medicine. And my wife and I, we raised 4 children. They're all are launched and have strong wings and are doing well. And Worcester's been great, and practicing has been good here. And
what was it like for your family, having a busy physician as a husband or a father?
I think you'd have to ask them. You'd get a more candid answer than you're going to get from me. I know that, and I know one or two of my children could offer you very candid opinions. But you know, I never had any hobbies that took me away from the home. We live right in Worcester. I was no further than 4 or 5 miles from my office or the hospital. I was on a beeper, and whenever I was home, my interests were photography and reading and music and gardening. So we bought a house with an unfinished lot behind us, and over 38, 39, almost 40 years, I've created a very beautiful garden, and now it's paradise. We didn't travel far from home. Occasionally we would take a family vacation for 1 week, 2 weeks to Cape Cod, but we probably didn't vacation as much as we should have. But the children all been well educated, and they're loving kids, so I think everything's been great. Yeah.
So you didn't find it difficult at all to balance your professional and personal life?
Well, it was difficult at times, of course. You have to prioritize. You're making changes all the time. My parents were here, and I took care of them through their failing health and ultimate passing. That was very, very difficult, trying to provide for them. My mother, may she rest in peace, particularly would communicate only with me. She after my father died, she became more and more withdrawn, and I was the person who could best communicate with her, and that was a major responsibility. Fortunately, we bought a house right around the corner from where my mother and father lived, so I was able to be attentive to their needs as best I could. Yeah. So, but emergencies and availability, coverage, it was hard. I mean, you're working every other night, every third night, and the emergency needs would you just had to travel when you were called. Staying healthy, trying to, most importantly, to take care of yourself. I mean, that's a very important message, I think, that if you're blessed with good health, I guess now they call it good genes, you've got to preserve what you have, and taking care of yourself is very important, as whatever your profession is. But as physicians, you need to take care of you. We need to take care of ourselves. We need to get adequate rest, nutrition, and have happiness beyond our profession.
Well, we only have about 5 minutes left or so on the tape. Is there anything that you'd like to bring up and talk about in the last 5 minutes that we haven't covered?
I feel like this has been a talkathon, and I haven't paused at all. I hope I haven't bored you with too much conversation. Perhaps I would like to mention that one of my very important professional fulfillments has been being involved with organized physician representation. When I returned to Worcester, I immediately became a member of the Worcester District Medical Society, the Massachusetts Medical Society, and the American Medical Association, and those organizations represent all of the doctors I mean, I also belong to specialty organizations in internal medicine and infectious diseases, but in organized medicine, the American Medical Association, the Massachusetts Medical Society, and the Worcester District Medical Society, we represent all of the doctors. And that team representation has been very, very fulfilling for me and rewarding for me. I'm very grateful for the opportunities to have served the Worcester District Medical Society and served as its president, the Massachusetts Medical Society, and served as its president in 1993, 94. And my continued involvement with the American Medical Association as a delegate to the AMA and to serving on its Council on Ethical and Judicial Affairs have been very, very important work for me, and because the groups really represent the doctors and what the doctors need in order to provide improved care for the patients. These organizations are not just about doctors, they're about doctoring. And how we doctor is important. And what the needs are for doctors to be able to do their work. And now sometimes it does involve finances, but you can't expect a doctor who's self-employed to find that his responsibilities are going up and up. His cost of operating his office is increasing while his income is decreasing. I mean, there are economic considerations, so as a profession, we have to address the economics of medicine, and young people, medical students, should learn about the economics of medicine. It's not a distasteful subject, it's an important subject. The physician is responsible for spending 75% of the healthcare dollar just by their fountain pen. You take out your pen and you write a prescription or whatever, or an order, that represents 75% of the healthcare dollar. Well, if the healthcare dollar is $1.4 trillion, you can see that represents a lot of money. And we need to be cost conscious because we're spending the money of the patient or the insurer that pays for it.